life, wisdom. I'm Psychiatry correspondent Carrina Rachel. Today on the Truth Talks, we're discussing homosexuality and gender identity disorders. There have been a lot of different things said about homosexuality. Some people believe that it is a choice, while others believe that homosexuality is determined by our genetics. Up until the 1980s, homosexuality was included among the mental disorders like schizophrenia and bipolar disorder. So I want to know what you think about homosexuality. Is it a choice or not? I'm joined today by Dr. Collin Ross. He's a psychiatrist and author based out of Dallas, Texas. Thank you so much for being here with me today.
Likewise. So
maybe you can begin by just explaining the history of homosexuality in relation to psychiatry, to mental disorders, and the way that the American Psychiatric Association views homosexuality.
Sure. Well, it's a heavy history, as you can see. Weighs quite a few pounds. And it goes back to the first edition of the manual in 1952. And then there was a second. The third was in 1980, fourth in 1984, and DSM V, May 2013. So going back to DSM I and II, homosexuality was in there, automatically a mental disorder. If you're gay, it's a mental illness. You're gay because you're mentally ill. End of discussion.
Wow.
And then in the 70s, we started to get a substantial gay and lesbian political lobby, including gay and lesbian psychiatrists. So in the DSM III in 1980, it was kind of half taken out. So you're now no longer mentally ill just because you're gay, but you could have ego-dystonic homosexuality. Okay, so that's big doctor talk. Basically, it meant you're not mentally ill because you're gay, but you have a mental disorder if you're conflicted or unhappy about being gay.
Okay.
So try being gay in a homophobic culture and not being at least a bit unhappy about it.
Right.
But then in the DSM IV, even ego-dystonic homosexuality was taken out, but it was even more quietly hidden in psychosexual disorder not otherwise specified, kind of right at the end of the section, a couple of sentences saying the same thing. If you're gay and you've got conflict or unhappiness about it, that's a mental disorder.
Right.
And now in the DSM V, it's nowhere.
Okay.
So you can't be mentally disordered even if you're unhappy about being gay. It's impossible. It's out. So that's the history of that. And one of the things that a little tiny bit different about the DSM V is they've tried to put different sections beside each other if they're closely related. So for instance, trauma and stressor-related disorders overlap and are related to dissociative disorders, which are next door.
Okay.
And then dissociative disorders clearly overlap with and are related to somatoform disorders. So that's why those three are back to back.
Okay.
And that's stated in the manual that they did that on purpose. And then when we get down here, we have sexual dysfunctions and gender dysphoria side by side because they got to do with sex, gender. And then we skip 4 or 5 sections and we get to paraphilic disorders, which are way far away because they're not related.
Okay.
So sexual dysfunctions are things like trouble with arousal and desire, not able to have an orgasm, premature ejaculation, delayed ejaculation. Okay. So they're kind of not caused by a medical problem. So the treatment is basically simple exercises with a partner and behavioral deconditioning and so on, which is often quite helpful. And so those are kind of more cut and dry. They're just behaviors, and people aren't happy about them. They come in for treatment. But they really don't have anything to do with being gay, and they don't have anything to do with gender identity disorder. But they're sort of next door because it's in the general ballpark of sexuality.
Right.
But what I want to focus on is the gender dysphoria. So it used to be called gender identity disorder.
Okay.
Now they've changed the name to gender dysphoria. And why has that happened? Well, it used to be automatically a mental disorder to be transgendered, meaning if I was transgendered, I would believe I'm a female stuck in a male body. For you, you'd be thinking you're a male stuck in a female body. And that is by itself a mental disorder. And that's what it says in the DSM IV. And now there's a change. Now you don't have a mental disorder simply because you're transgendered. you have to have gender dysphoria. That is, I would believe I'm a female stuck in a male body. But if I just believe that and I feel fine, not a mental disorder. I have to believe I'm female, trapped in a male body, and have dysphoria, which basically means depression, unhappiness. Now that's a mental disorder. So let's just compare that to the history of homosexuality. Basically, the DSM has made the same move with a little lag time. Mm-hmm. Having gender identity disorder used to be automatically mental disorder. Now we've softened it. Oh, it's not automatically. The mental disorder is really the conflict and unhappiness about it.
Right.
Exactly what we did with homosexuality. It was a mental disorder. Oh, no, it's not really. It's only a mental disorder if you're unhappy about it. And then the next step was it disappears totally. So I would say it's pretty clear to me that gender identity disorder is following the same track. It's just 20 years behind. Because once you go from it's really a mental disorder to it's only a mental disorder if you're unhappy about it, mm-hmm. then there's going to be a transgender lobby group, just like the gay lesbian lobby group, that's going to want it out altogether, and out it goes. So here we have this official, written in stone, concrete, diagnostic and statistical manual diagnosis, and it's really just part of a political evolution.
Right.
It's really not actually any more legitimate disorder than homosexuality. It's just the history of it's delayed by 20 years.
Right.
And then with gender identity disorder, there's a whole another level of problem, which is if you're gay, you can't go to a surgeon and get reassigned to being straight because there's no surgery for it.
Right.
There's no identified genetic abnormality of any sort. There's no hormonal abnormality. Nothing has been found in the gay brain or body mm-hmm. or genitalia that's consistently different from straight people. Mm-hmm. So therefore, there's nothing to do surgically. Mm-hmm. But with gender identity disorder, you can do gender reassignment with surgery and hormones. But this is where the logical problem comes in. If you're going to be a member of the lesbian, gay, transgendered lobby group, they're all together now as a unified group. Mm. You're surely going to be lobbying to get homosexuality out of the diagnostic manual.
Right.
So then why would you not be lobbying to get gender identity disorder out of the manual? We've already kind of half started the process of taking it out.
Right.
But if it's not actually a mental disorder, then why should insurance companies pay for gender reassignment? Why isn't it just like cosmetic plastic surgery of any kind?
Wow.
So then the transgender people have got a problem because they don't want to pay for the surgery themselves. They want the insurance company to pay for it. In order for the insurance company to pay for it, it has to be a mental disorder diagnosed by a psychiatrist.
Wow.
But, so there's a contradiction and a conflict there.
Right.
And then you come to the psychiatrist. The psychiatrist has to diagnose a mental disorder. But if it's a mental disorder, how come we're changing the body to match the mental disorder?
Right. That's
just like the person's delusional, so we're going to paint their skin black so that they look like they actually are black.
Right.
So if you do, as soon as you actually do gender reassignment with surgery and chemicals, you're basically saying, no, this makes sense to reassign the person because they really are a female trapped in a male body. So then it doesn't make sense to call it a mental disorder.
Right.
So it's a complete set of contradictions from both sides. And I'm sure the political history of it's going to be, it'll get dropped. And funnily enough, the people who protest that the most loudly are going to be the people who are invested in having the insurance companies pay for it, who are also the people who don't want to be stigmatized and experiencing discrimination in the workplace and are going to want to be lobbying for gay and lesbian marriage being equal footing with heterosexual marriage. So it's just a huge bundle of contradictions. And the American Psychiatric Association in this manual is just inside the contradictions and inside the history, not bringing clarity to the problem.
Right.
And check back in 30 years, there's no way that the manual is going to be treating gender dysphoria the way the DSM V does.
Right. So, as a psychiatrist, what situation does that put you in when somebody comes to you and presents either homosexuality or this gender dysphoria as you describe it?
Well, basically, what happens is you operate inside the rules of the system, which is I'm a psychiatrist. I've diagnosed gender identity disorder. Oh, now I'm diagnosing gender dysphoria, which doesn't really make any difference because nobody would come to a gender identity clinic if they weren't unhappy about the situation and didn't want reassignment.
Right.
So I diagnose a mental disorder, and I tell the insurance company that the person really meets the criteria and they don't have other disorders and they're a good candidate, and I get paid and the insurance company pays and everybody's happy. And we just kind of don't look at the contradiction.
Right.
We just skim around it, don't comment on it. Because it's nice to help these people.
Right.
But it's nice to help people if they feel like they need a chin tuck or a breast augmentation. Why don't we have, a mental disorder of thinking that your breasts are too small or too big?
Small breast dysphoria.
Right. Which is a very common disease in our culture.
Right. So, by that rationale, for people who, because I think what's interesting here is you've presented that clearly for someone who is homosexual or someone who has this gender dysphoria, this feeling that I'm the wrong, I'm, one gender trapped in another gender's body, and this is incorrect. There is that very kind of critical issue of the stigma associated with having a mental health diagnosis.
Right.
So there, I think that you really point out an interesting, maybe conflict of interest, which is that, certainly people that fall into these categories would probably prefer not to have the stigma of a mental health diagnosis. But at the same time, in order for the insurance company to pay for their surgery they want, well, then they're going to have to have this mental health diagnosis. Exactly.
So then you kind of really shouldn't be able to have it both ways at once. You shouldn't be part of the gay, lesbian, transgender lobby group that we want equal rights. We don't want to be discriminated against. There's nothing wrong with us. We should be able to get married, and we want the insurance company to pay.
Right.
You should have it one way or the other, but not both.
Certainly. And certainly I think it's important to recognize that when we're talking about gender equality, equal rights for homosexual marriage and things like that, as you said, you can't have it both ways. If you want equal rights and all of this, then, you can't at the same time have this, mental disorder, mental diagnosis status that then is going to require an insurance company to pay, for the supposed surgery.
And I assume, if an insurance company senior executive was listening to this video, you'd go, hey, wait a minute. He's got a point there. There's no reason we should be paying for this.
Mm-hmm.
And that's where the crunch is going to come, when the insurance companies realize, hey, this is contradictory. This is not medical science. This is just a political viewpoint in evolution. We're looking at this slice in time, but it's probably going to disappear from the manual just like being homosexual did. So what the heck? We're not going to pay for it.
Right.
That's where the crunch is going to come.
And certainly insurance companies are, jump at the chance to cover less things.
Right.
But that would make a very, loud and clear statement about the status of these so-called mental disorders associated with homosexuality and gender identity.
Which then if we keep flipping the coin and flipping the coin and flipping the coin, now we're back to, we agree with you. You're not mentally ill. This is not a delusion. You don't need antipsychotic medication. You have a perfect right to gender reassignment. We shouldn't discriminate against you. We shouldn't stigmatize you. Mm-hmm. You should have all the rights of anybody else.
Right.
But we're back to that one little catch. No reason that the insurance company should pay for your plastic surgery and not for the plastic surgery of the woman who wants bigger breasts.
Right. Let's go back to the question of homosexuality, genetic or a choice. Because you mentioned earlier that there is no genetic or physiological difference that has been discovered between a person who is homosexual and a person who is not.
Right.
That when we're trying to look for a homosexuality gene or some kind of way that you could physiologically test someone's body and determine whether or not they're homosexual without them telling you, that there would just be no way to do it.
Right.
So this idea...
Maybe in the future, but definitely not now.
So this idea that, well, if it's not a physiological... it's not a result of your physiological state. It's not a result of your genetics. Does that necessarily mean that does that make it a choice? Or...
Well, it all depends which end of the spectrum you're on. So somebody who's gay or pro-gay lesbian could want it to be genetic, so that it's not our fault, so it's not a choice, so it's not a moral issue. It's just how we're born. Mm-hmm. But on the opposite side, somebody could want it to be genetic because then it's a genetic disease and we shouldn't condone people doing genetically diseased behavior.
Right.
Somebody on the gay side could say, we want it to be a choice, so it's not a disease and it's not a defect. But then somebody on the homophobic side will say, we want it to be a choice because it's a bad choice and it's against God.
Right.
So you can take both choice and genetic and spin them either way.
Mm-hmm. So when we're talking about these mental disorders, I think that kind of the obvious kind of next question that it leads to is the treatment that is then prescribed based on the diagnosis. And we get back to talking about medications largely as the kind of primary form of treatment. And, whether or not we should be medicating people who, arguably maybe have this mental disorder that is no longer considered a mental disorder. So where 20 years ago they were receiving, psychiatric medications because they had this mental disorder, well, now nothing about them has changed, but it's no longer considered a mental disorder. What are the implications of that kind of
in terms
switch?
Of the whole mental health field? This whole gay transgender thing just illustrates that it's not science. It's highly affected by politics.
Right. And, what are the kind of further implications for the people, the individuals who have received a diagnosis like that and who were given some kind of psychiatric drug treatment as a result of that diagnosis?
That would be another 10 videos to get into all that. And we have discussed that in previous videos a lot.
Right.
But it gets us to what do these labels really mean, and are they helpful or harmful? Mm-hmm. Do they lead to helpful treatment or harmful treatment?
Okay. Well, thank you so much for your time today. This has been incredibly interesting, and we'll look forward to future videos.
Yeah, me too.
Thank you as well for joining us. Please be sure to subscribe to the Psyche Truth channel so you can see our future videos where we're going to look a little bit more detail at some of the other disorders in this new DSM V. Look forward to seeing you again soon. Be sure to hit that like button if you enjoyed this video or found it helpful. Thanks so much, and we'll see you next time.